So this is our injector. Throughout Bay State, we use the MedRad injector. Most of our injectors are a dual head system. This one in particular is. So what that means is we have an injector syringe for saline and an injector syringe for contrast. Blue is water, so you'll remember your saline is going to go in the blue side. Contrast is the green side. Typically what we use for contrast in the Bay State system is IsoView 300. Most of our injections is a 100 milliliter bottle. So this is one of those things that you're going to check to make sure the patient doesn't have any contraindications, that they're allergic to contrast, and that they meet the criteria to inject, or you're going to check their lab values to make sure their kidney function is okay. So what we're going to do is we inserted the syringes, and now we're going to put on the spikes so that we can draw up the contrast and the saline. So we put the larger, if you have a kit that has a smaller syringe and a larger syringe, the larger syringe is going to go on the saline side. This makes it easier to draw it up. And what we're going to do is open up the saline. A little difficult to get these out. Often scissors make the job much easier. And different sites use different things. We use a single saline bag, and other places use a multi-dose saline. So it's very important not to touch anything to the connectors. They are sterile, and if you do happen to touch any of the connectors, you do want to wash it down with alcohol before proceeding. You're going to hit the auto load button. Increase it to what you're going to fill up, and fill. What it's going to do is pull back a little bit, pull in some of the saline, some of the contrast, and then it's going to expel the air. Very important to make sure there's no air in your syringes so that we don't inject air into the patient. Very important when you take the contrast bottle off to make sure that you don't drip contrast down into the rings. It will lift these up. So what you'll do is just clean it up immediately. The contrast is very sticky, so if you get it on your hands, you'll want to use warm water to wash it off right away. It's going to purge some of the air. Go to what I set it at, 100 cc's each. Going to take the tops off. You're going to just manually forward the syringe until you get a bubble on the top of each. Now we're going to have our tubing. We have the two head tubing, and each of the orange parts are going onto a syringe. You want to hold it just like that, so that when you connect it, it easily connects both of them together. And the next part is extremely important. You want to forward and prime the tubing to push all of the air out of the tubing. So each of these has a prime button. You're going to push the prime button and you watch till the fluid actually comes out. If you're not sure, you can manually turn the heads, and they have a prime tubing. You can leave that on. When you do the priming, the tube will fill up. Now you're all set. Now you know you primed it. You're going to hit the check button, which says I checked for air and I know this is safe to use. I'm going to flip it over, and now it's ready to use.